Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. I wish you and your loved ones a happy new year. Thank you so much for the support that you accorded me last year. I am back to continue the series of the hospital-acquired infections, and today's video is about the hospital-acquired non-catheter-associated urinary tract infection. The hospital-acquired non-catheter-associated urinary tract infection is an infection in the system of your body that forms urine, and it usually occurs 48 hours or more after admission to the hospital or 48 hours after discharge from the hospital, and it usually occurs in individuals who don't have a catheter in place. The hospital-acquired non-catheter-associated urinary tract infection is caused by microorganisms, germs, especially the bacteria. The commonest bacteria include Coccidioides difficile, Escherichia coli, Klebsiella pneumoniae, Enterococcus, Pseudomonas aeruginosa, the methicillin-resistant Staphylococcus aureus, and the multi-drug-resistant bacteria, for example, the extended spectrum beta-lactamase-producing bacteria. How do these bacteria reach the patient to cause the infection? One of the ways is through direct contact, especially contact with contaminated hospital surfaces. For example, the walls of the ward, the dirty floor of the ward, the bed rails, bedpans, hospital bathrooms, toilets. When you touch these surfaces and then you don't wash your hands and you accidentally touch your private parts. For example, you are in a bathroom and then you're touching the surface or the walls of the bathroom in the hospital, and you're using the same hands to wash your private parts. You can easily introduce the bacteria that was on the walls of the bathroom or the walls of the toilet, or maybe you're in the ward and then you touch the walls of the ward, or for some reason you touch the floor of the ward and then you don't wash your hands, and for some reason you touch your private parts, or you're trying to clean your private parts, and then you introduce the bacteria into your private parts, and then the bacteria can go through your urethra, the tube where urine comes from, and then the bacteria can ascend, or it can move upwards into the bladder, it can go to the ureters and then your kidneys. So that is how you end up with the hospital-acquired non-catheter-associated urinary tract infection. The other way is through contaminated hospital equipments. For example, an instrument called the cystoscope. A cystoscope is an instrument that we use to visualize or to see what is happening in your bladder. So if it was contaminated, it can also introduce the bacteria into your system that forms urine. That is the urethra, then it can go to the bladder, and then the bacteria can ascend into the ureters and then into your kidneys. These instruments can also cause some damage or some slight damage to the lining of these parts of the system that form urine. That way, these parts of the system that form urine are susceptible to getting infected. The other way is through transmission by the healthcare providers. If the healthcare providers don't wash their hands or they don't exercise good infection control precautions, they can transmit bacteria from one patient to another. For example, a given healthcare provider can care for a patient's wound, and for some reason they have not put on gloves, and after that they don't wash their hands. And if they go and attend to another patient, for example, maybe the patient needed an examination of their private parts, and then the healthcare provider can transmit the bacteria they got from the other patient to this other patient's urethra. The bacteria can ascend from the urethra to the bladder, to the ureters, and to the kidneys. The other is through instrumentations and procedures. Procedures like the transurethral resection of the prostate, where we pass an instrument through your urethra, the tube where urine comes from, to remove the prostate. Or the transurethral resection of the bladder tumor, where we pass an instrument into your bladder to remove a tumor or a swelling or a mass from your bladder. This way, the instrument that we are using to cut the prostate or to remove the bladder tumor, if this instrument is contaminated or if it has bacteria, the bacteria can be introduced into the urethra or into the bladder, and then the bacteria can ascend into the ureters and into the kidneys. So that way you can end up with the hospital-acquired non-catheter-associated urinary tract infection. This is why it is very important that the instruments that we use should be well sterilized, so that the patients don't end up with a hospital-acquired non-catheter-associated urinary tract infections. Who is more susceptible to getting the hospital-acquired non-catheter-associated urinary tract infections? Individuals that have underlying comorbidities, for example, diabetes mellitus, hypertension, the elderly, that is more than 65 years of age, individuals that have had a prolonged hospital stay, those on proton pump inhibitors. These are medications that we use to treat the peptic ulcer disease. Individuals that have a low immunity for some reason, maybe they have HIV, they have diabetes mellitus, they are on steroids or they are on anti-rejection drugs. Maybe they underwent an organ transplantation. Individuals that have had procedures or surgeries done in the system of their body that forms urine. Individuals that cannot ambulate or they cannot move, they are not mobile for some reason. How do you know if you or your loved one has the hospital-acquired non-catheter-associated urinary tract infection? They will develop a fever while in the hospital or 48 hours after discharge from the hospital. Their body temperature will be more than 38 degrees Celsius. Basically, they will be very hot when you touch them. They'll also have chills, that is, they'll feel cold. Rigors, that is, they'll shiver, they'll be shivering. Fatigue, that is, body weakness. They'll also have suprapubic pain, that is, pain in the lower abdomen. They'll have urinary frequency. They'll be urinating several times in a day, more than 8 times in a day. They'll also have hesitancy, that is, difficulty in initiating urination even when they have the urge to urinate. They'll also have urgency of urination, that is, they will not be able to postpone urination. Dysuria, that is, pain or burning on urination. The individual will feel like there's something burning them as they urinate, or they'll feel pain when they're urinating. These individuals can also present with altered mental status, especially the elderly. The only thing the elderly patients might present with can be altered mental status, for example, confusion. So it is very important that the healthcare providers and the caretakers of the patients look out for any changes. The individual might just become confused, and it can be the only presentation for the hospital-acquired non-catheter-associated urinary tract infection. There can also be changes in the urine, The urine might be bloody, it might be cloudy, and sometimes it can also be very foul smelling. It will be smelling very bad. What are the complications of the hospital-acquired non-catheter-associated urinary tract infections? Pyelonephritis, that is infection in the kidneys. Renal abscesses, that is collection of pus in the kidneys. Acute kidney injury, that is a rapid decline in the functioning of the kidneys. And this usually happens within hours or days of acquiring the hospital-acquired non-catheter-associated urinary tract infection. How can we investigate individuals for hospital-acquired non-catheter-associated urinary tract infections? We can do a urine analysis, and this can help us to look out for white blood cells, bacteria, leukocytes, esterase, and nitrites. We can also do a urine culture and sensitivity. A urine culture and sensitivity, by the way, is the gold standard investigation for the UTIs. This is because it can help us identify the real microorganism, the real germ, for example, the bacteria that is causing the hospital-acquired non-catheter-associated urinary tract infection. For example, Escherichia coli, Klebsiella pneumoniae, Pseudomonas aeruginosa, and this can help us to do a targeted antibiotic therapy. That is to give an antibiotic that will target that specific bacteria, because the urine culture and sensitivity can help us identify whatever that bacteria is, and it can also help us to ascertain the antibiotic that this particular bacteria is susceptible to. We can also do a blood culture, especially if the patient has developed sepsis, that is an exaggerated response to the bacteria. Especially if the bacteria goes into the bloodstream, the body can have an exaggerated response to this bacteria. We can also do inflammatory markers, for example, white blood cell count through a complete blood count. We can also do CRP, that is C-reactive protein, ESR, that is erythrocyte sedimentation rate, and we can also do procalcitonin levels. These inflammatory markers are very important because they can help us to monitor the progression of disease and also to monitor the response to treatment. We can also do radiological investigations, for example, an abdominopelvic ultrasound scan. This can help us to ascertain if there is any obstruction in the system that forms urine, or if there are complications, for example, pyelonephritis, that is infection of the kidney, or renal abscesses, that is collection of pus in the kidneys. We can also do an abdominopelvic CT scan. It also looks out for obstruction in the system that forms urine or complications of the hospital-acquired non-catheter-associated urinary tract infections. For example, the pyelonephritis, that is infection of the kidneys, and renal abscesses, that is collection of pus in the kidneys. How do we make a diagnosis of the hospital-acquired non-catheter-associated urinary tract infection? According to the Center for Disease Control and Prevention, CDC, a diagnosis of the hospital-acquired non-catheter-associated urinary tract infection is made by a combination of the clinical evidence and the laboratory evidence. For the clinical evidence, the individual should have at least one of the following: fever, that is an increase in the body temperature; urgency, that is the inability to postpone urination; hesitancy, the difficulty in initiating urination even when the patient has the urge to urinate. Frequency, that is urinating several times in a day, that is more than 8 times in a day. Suprapubic tenderness, that is if the doctor touches or the healthcare provider touches the lower abdomen of the patient, pain will emanate from the lower abdomen. However, the individual should not only have one of the signs and symptoms I've talked about, but they should also have supporting laboratory evidence. For example, a urine analysis, a positive urine analysis that will reveal a positive leukocyte esterase, presence of bacteria, white blood cells, nitrites, a positive urine culture and sensitivity, that is more than 100,000 colon-forming units per mil, and there shouldn't be more than 2 species of bacteria isolated during the culture and sensitivity. How do we treat the hospital-acquired non-catheter-associated urinary tract infections? We usually employ the targeted antibiotic therapy. That is, the antibiotics or the medications we use are always tailored by the results from the urine culture and sensitivity. However, before the results of the urine culture and sensitivity are availed, we employ the empirical antibiotic therapy. For example, the 3rd and the 4th generation cephalosporins. 3rd generation cephalosporins, for example, ceftriaxone. 4th generation cephalosporins, for example, the cefepime. We can also employ the carbapenems, that is meropenem, imipenem. We can also employ piperacillin tazobactam. These are the commonest initial choices that we use as the empirical antibiotic therapy as we wait for the results of the urine culture and sensitivity. And once the results of the urine culture and sensitivity are availed, we usually switch to the antibiotic that has been revealed by the results from the urine culture and sensitivity. We usually give the antibiotics between 7 to 14 days, depending on the severity of the hospital-acquired non-catheter-associated urinary tract infection. We also do supportive management, that is fluid resuscitation. We give the patient fluids through the veins, but we also encourage the patients to drink the water via mouth, because this can help to flush out the bacteria from the system that forms urine. The more the patient drinks water, the more they urinate, and the more the bacteria is flushed out to the urine. We also give painkillers, analgesia, because majority of the time these patients have pain on passing urine, and they also have pain in their lower abdomen. How can we prevent patients from contracting the hospital-acquired non-catheter-associated urinary tract infections? Infection control precautions are very important. For example, hand washing. For the healthcare providers, please ensure that you put on gloves when you're caring for all patients. Never touch patients with your bare hands, because when you touch patients with your bare hands, you can easily transmit the bacteria from one patient to another. And even when you have put on gloves, please ensure that you wash your hands after you have cared for any patient. It is very, very important in the prevention of the hospital-acquired non-catheter-associated urinary tract infections. Thorough hospital environment cleaning is very important. For example, the floors of the ward, the walls of the ward, the door handles, bedpans, bed rails, bathrooms, toilets. Because when the hospital environment is dirty and smelly, the patients easily get contaminated, or their hands easily get contaminated because they touch these surfaces of the hospital environment innocently because they are unaware of the repercussions. So it is very important that we keep the hospital environment clean. To the unit heads, please ensure that the wards are clean, the bathrooms and the toilets are clean. They shouldn't be smelly, they shouldn't be dirty, because these patients can go to the bathrooms and they touch the walls of the bathrooms, the walls of the toilet, and most likely they're in the bathroom showering, but they have touched the walls of the bathroom, and then they are using the same hands to wash their private parts, and that is how they end up with the hospital-acquired non-catheter-associated urinary tract infections. So to emphasize, please ensure that the hospital is clean. Let it be a nurturing environment, both for the patients and also the healthcare providers, because we spend majority of our time in the hospital as the healthcare providers. So it is very important that the unit heads spearhead the cleanliness of the hospital environment. Let the wards be clean, let the bathrooms be clean, the toilets. The hospital environment should be nurturing and clean. Maybe to add and emphasize about hand hygiene. This shouldn't only be done by the healthcare providers. Patients should also exercise good hand hygiene. When you touch a wall of the ward, a bed rail, a bedpan, please wash your hands as a patient. Even if it is maybe the relative that is taking care of the patient, please, when you touch the walls of the ward, the bed rails, the bedpans, the whatever surface you've touched in the hospital is a potential source of infection. So it is very important that you don't touch surfaces in the hospitals anyhow. And if you must touch a surface, please wash your hands, because the hospital is a home for bacteria and other germs. And the worst bit is these bacteria these germs have found ways to survive, because we keep giving patients antibiotics or we keep giving patients treatment. So they always change in order to adapt to the medications we give them. So it is very important that you take care of yourself when you're in the hospital. Don't touch surfaces anyhow. And if you have touched a surface, for example, the wall of the ward, the floor of the ward, the walls of the bathrooms, the bed rails, bedpans, wash your hands, because if you don't wash your hands, you can easily get contaminated by this bacteria, and sometimes these bacteria are resistant to so many antibiotics. So you might even get a bacteria that doesn't have any antibiotic that can kill it. To emphasize, the medical students, the patients, healthcare providers, the relatives of the patients that are taking care of the patients, please avoid touching hospital surfaces, because these are usually potential sources of contamination or infection. Please also avoid unnecessary instrumentation. For example, patients that don't need a given procedure or instrumentation, please don't do it, because it might actually be a portal, or it can cause these patients to acquire the hospital-acquired non-catheter-associated urinary tract infections. That is what I had for you. Thank you so much for watching and listening. Please share, like, comment, and subscribe. Also hit the notification bell such that you can get notified whenever I upload a video. Please also support the work that I am doing on this platform by purchasing any of my items from my electrical appliance online store. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda at a free cost. You don't have to pay for the delivery, but in the future I'll be able to ship to those outside of Uganda. Thank you so much, and I'll see you in my next video. Bye.